Hello and welcome to Health Professional Radio. I'm your host, Neil Howard, with Dr. Len Friedland of GSK this morning, and he's joined by Alice. She's a former shingles patient. Welcome to Health Professional Radio, Dr. Len Friedland and Alice. Thank you both.
Thank you.
A little bit of your background, if you would, Dr. Friedland.
Yeah, hi. I'm Dr. Len Friedland. I'm a vaccine research scientist at GSK Vaccines, where I've been involved in the development of more than 16 vaccines that are recommended and available for people in the United States of all ages, including, of course, adults. And I'm also a pediatrician in the state of Pennsylvania. And I love what I do because I get to talk about how vaccines can help keep us healthy and live strong lives.
And Alice, you're joining us today as a former shingles patient. Give us a little bit of your background, if you would.
Yes, my name is Alice. I'm a journalist in Washington, D.C., and I had shingles in 2016 when I was 57 years old.
Now, today, Doctor, you're going to talk about how the ordering rate of adult vaccines has dropped significantly since the onset of the COVID-19 pandemic.
That's absolutely right. So during the pandemic, no surprise, people stopped going to care, and that includes adults. And so there were dramatic declines in the number of visits for routine medical care and dramatic declines in the number of adults who were receiving their recommended vaccines. This is really important because this is placing our adult population at risk of infectious diseases, which we all know from the pandemic how dangerous infectious diseases can be. And as we head into the fall, we want to keep our population healthy. We don't want people taking up space in emergency departments and hospital beds, potentially even ventilators with diseases that could have been prevented through vaccination. And so we wanted to find out more. So we did some research and we spoke with adults aged 50 to 79 through a poll. And we found out that many adults are unfamiliar with the vaccines that are recommended for people over the age of 50. When we asked further, we found out that most adults see the importance of vaccination. They recognize the dangers of infectious diseases. They see the value in adult vaccination. However, less than half say they're going to do something about this. Less than half say they're more likely now to get one of the adult recommended vaccines. And what they say, actually 3/4 of adults in our research say they need more information about what these vaccines are.
Alice, were you aware of the recommended vaccines before your diagnosis with shingles?
No, to my great regret, I was one of those people that was not aware of the vaccines that were available, and I really knew very little about shingles at all when I was hit.
What is shingles?
Well, I'll let Dr. Friedland address that medical question.
Okay.
Sure, I'll get started and then we'll come back to actually how it played out with Alice.
Okay.
So shingles is a disease caused by a virus. It's called the Herpes Zoster virus. It's a very common disease. 1 million new people every year in the United States over the age of 50 have a case of shingles. Our lifetime risk over the age of 50 is 1 in 3. And it shows up, it presents, as we call it medically, it shows up as a painful, blistering rash where the pain can last for months. And if it gets the rashes in parts of our body, like our eye, we can have other complications. This disease can be absolutely debilitating. It can stop people in their tracks and just take life down a completely different path for many, many months, sometimes even years. The good news is that it's vaccine preventable, and we'll come back to that after Alice tells you more about her situation.
Yes, in the summer of 2016, I was having a great summer. I was working full-time, and I was getting ready for my wedding, which was just coming up in a few months in the fall. And all of a sudden, all that stopped. I was hit by an incredible headache, the worst headache of my life, just came out of nowhere. And I went to the ER. I actually went there 3 times and did not get diagnosed. A couple of days later, I got a rash on my forehead in the eye area, and I was diagnosed with shingles. And as Dr. Friedland said, it was very painful. It was pain for months, and this can be very serious. I had severe light sensitivity in my eyes. So I bought dark curtains. I put them in my house, and I had to spend time in a dark room basically for months. I couldn't watch TV. I couldn't really go on the computer until I got a special program to make it less light. And I didn't enjoy reading. So it was a very difficult time for me. And fortunately, I do write songs. That's kind of my hobby. So I wrote a number of songs about my experience and wrote a whole musical, actually. But because I want to raise awareness about this disease, a lot of people don't realize how serious it can be. And so I would encourage people to talk to their doctors, find out their risk factors, and find out about the vaccines available. I am so regretful that I didn't know. I hardly knew anything about shingles at the time that I got hit. And I really hope that that doesn't happen to another person.
Doctor, what are the vaccines that are recommended, and what's traditionally the treatment for shingles? Do you simply have to run its course, or is there some treatment to offer relief?
Yeah, let's first start just about a little bit about shingles, and then we'll get to the vaccines that are recommended. So shingles is caused by a virus that reactivates in our nerves, and as mentioned, it's very common. 1 in 3 people over the age of 50 will have a case of shingles over the course of their life, and the treatment of the pain can be very complicated. There's no one medicine that works for everybody. In fact, for some people, there are no medicines at all that can help with the pain. And sometimes the pain can last for months, if not years, and can be absolutely devastating. And so the best treatment for shingles is actually to prevent it from starting in to begin with, and that's through vaccination. So what are the vaccines that are recommended for people over the age of 50? They include shingles for everybody over the age of 50, a vaccine to protect against pertussis or whooping cough, of course, the vaccine to protect against influenza, so important this year as we move into the fall and we still have the COVID-19 pandemic. And then also for people over 65, there's a vaccine to protect against pneumonia. Information about all of these vaccines that are recommended for adults can be found at a website at broughtbyvaccines.com, and I'll spell that, BROUGHTBYVACCINES, broughtbyvaccines.com. And the other thing to mention is that you may be asking, well, is it safe for me to go to the doctor's office? Is it safe for me to go to the pharmacy and get vaccinated? And the answer is yes. Doctors' offices and pharmacies have created safe ways and safe places to get people vaccinated. So, broughtbyvaccines.com to find out about all the vaccines that are recommended, can be done safely. Take action and keep yourself protected. broughtbyvaccines.com is the website.
And Alice, how are you doing today, and what would you like to say to other people who may be suffering with shingles or hopefully can prevent it?
Well, I'm one of the fortunate people that got over this. I also made sure to go out and get the shingles vaccine for myself about 2 years after I had it. So my message really is to talk to your doctor, find out about your risk, and consider getting the vaccines to prevent this from happening to you.
Dr. Friedland, Alice, I thank you both for joining us here this morning on Health Professional Radio. Thank you so much.
Thank you.
Thank you.
You're listening to Health Professional Radio. I'm your host, Neil Howard. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au.